suddenly feel, and to know once again that what I feel is real. I could cry, I could smile, I might lay back for a while. Tell me what would I do if I could feel?
I'm not really sure about sickle cell, but I know it has to do with the blood, the cells. I'm thinking that it's something to do with an abnormal production of bodily hormones, something like that.
I know it's a disease, isn't it? When weak cells are being attacked by your own immune cells.
Very close friend. He had that, and it was terrible because sometimes I seen him up, sometimes I seen him down.
So, most familiar with it is that it's a blood condition that sickles the blood cells. They become sickled in shape, and of course, I think we all kind of know that it affected one of the members of TLC.
Sickle cell, I'm not really too familiar. So I have to go back and do some more research on it. However, I do know that it mostly affects the Black community, and I believe that it's hereditary.
And when you see the child, they normally have the symptoms. They have the yellowish eyeball.
You too.
They have tiny hands, legs, and big tummy.
There was one particular, because I'm a Pittsburgh Steelers fan, so Ryan Clark, I believe was his name, was a player who had it, and he used to couldn't play when they went to Denver, because Denver's altitude, I know, affected, it has something to do with his sickle cell. It would affect his sickle cell, and he wouldn't be able to actually play a game without getting sick.
Sickle cell anemia, from the word anemia, lack of iron in your blood. So then I remember sickle cell being something like the cell itself is really irregular sized and gets stuck traveling through your body. And that's what.
Tell you the truth, I really hate it. Tell you a little story, man. I had a friend of mine, a real close friend of mine. We was little. Go out, go pool, go having fun. I go to his house next day, he in the hospital, sick. I asked him, Mom, what's going on, man? Long story short, he had sickle cell. When we was little kids, I didn't know about this disease. Past time now, 6 years, he did 6 years of time in prison. Come home 6 months later, pass away. Sickle cell.
What I know about sickle cell anemia is, I will say that I believe it primarily affects African American population. I believe it's some type of blood dis-ease.
And what I know about sickle cell, that I am a trait carrier, and the sickle cell keeps my immune system down. I stay cold, I eat a lot of ice, and the B12 really doesn't work, and the iron pills really doesn't work because of the trait that I have. It was hereditary, and I was born with it, so I just deal with it day for day. But it is something.
I don't know, man. It's probably like some type of mutation, or probably keeps you sick all the time. I really don't know that much about it, man. I guess I should do some more research into it.
Our red blood cells make up 40% of our blood's volume. They're made continuously in the bone marrow, looking like flattened donuts without the holes. Red blood cells contain hemoglobin, a bright red protein which gives blood its color. Then, the red blood cells and hemoglobin transport the oxygen throughout the body and release it to all our cells and tissues. When the hemoglobin molecules are emptied, they attract carbon dioxide and other waste gases, which they take back to the lungs to be exhaled. Anemia occurs when there are too few red blood cells or not enough hemoglobin. Exhaustion is the common sign of anemia. In people with sickle cell disease, their red blood cells become deformed, turning sickle-shaped. The bone marrow tries to make more red cells to make up for the loss, but can't keep up, causing anemia. Their new shape keeps them from moving properly through the body, and the misshapen cells can jam up and stick to the walls of the blood vessels. These clumps cut off oxygen to healthy tissue, delaying a child's normal growth and causing fatigue and extreme pain.
So the classic sickle cell disease is when you inherit something called sickle cell trait from both parents. Sickle cell trait is very common in the African American population. The estimates range from 8 to 12% of people having this, which is very high. That means 10 out of every 100 people will be a carrier.
I grew up in Harlem, New York, Kings Towers, aka Foster Projects. I met my wife. I officially met her in junior high school, although we went to the same elementary school. We didn't know each other then, and then we crossed paths once more in junior high, and in high school, you know, she was a year ahead of me, so she got there before I did. So when I came in the 9th grade, she realized what kind of man I really was. She made a move on me. So, high school sweethearts, 9th grade, she scooped me up unwillingly at first. I went kicking and screaming, but you know, how many times can a man say no?
Henry Martinez, Harlem, New York. I grew up in Harlem, 114th Street, 7th and 8th. The real New Jack City era. When I went to school, them water puddles had crack valves, 12 bags on the floor. Real era, like, it was real crazy back then. I was thankful though. I grew up in a family environment block, Play Street, PAL. Everyone knew each other's mothers, fathers, sisters, brothers, grandmothers. It was all love. I met my spouse in high school, Martin Luther King. I had a thing for her back then, but it was quiet because I ain't stick around there too long. Then we hooked up some years later, and it was all magic from there.
When I first learned about sickle cell, I've heard of it, the word. I didn't know what it meant, but my cousin had it as we was while we were growing up. My older cousin, but we were kept sheltered from it. Our parents, uncles, and them, they wouldn't allow us to really know what was going on with it. And all we knew was that she was in the hospital a lot, and she had something called sickle cell.
I learned about sickle cell in 1995 after losing my virginity and my mom taking me to the doctor. I learned that I had the trait and I got scared. I started to cry. I thought I caught something because I didn't know what it was. But throughout the years, I knew I had the trait, and that's all it was. I didn't have too much knowledge of it.
It wasn't taught. It wasn't spoken about. So that's just what it was until I became older. And then I've noticed I had friends with the disease, a family member or two with the disease, and that's when I started to think.
When I found out that I had the trait, I was the same age. My mom's explained it to me. She's like, what Sinead has, you have some of it, but you don't have enough of it to where you're sick like she is. So you have sickle cell trait. And then she explained to me, I think I was a teenager, and she explained to me that the reason that Sinead had the disease was because her mother and her father both had the trait. So I think as a teenager I learned, 2 traits equal to disease, and I always said like I would never put a child in that situation.
I had a minor discussion about it. I told my spouse that I had the trait. I learned about it when I was 15. She also discussed to me that she had the trait.
I think me and Vita, we were probably about 3 years into our relationship when we first discovered that we both had the trait. And I remember saying to her, I was like, I'm a teenager, I didn't care. I was like, look, we both got that trait, so we will never have kids. And, I laughed it off, but I could see the disappointment in her face. Like, at that time, it wasn't a big issue. And I wasn't even thinking about children or whatever the case may be. I was a teenager having fun. And so it wasn't that big of a deal.
There are other types of sickle cell disease as well, something called hemoglobin SC, hemoglobin SD, hemoglobin SO, and so on. And there's also something called hemoglobin S thalassemia. What happens in S thalassemia is you get a gene from one parent that doesn't make any hemoglobin or makes less hemoglobin than it should, and that, when it's inherited along with sickle cell trait, is a type of sickle cell disease. And the other abnormal types of hemoglobin I mentioned, S, D, O, and there's a few others. Those are other abnormal types of hemoglobin that were inherited along with sickle cell trait, can cause types of sickle cell disease, which may be more moderate than typical sickle cell disease, but it's sickle cell disease regardless. And one of the problems that we have in the community is people are not recognizing this and not necessarily doing proper testing prenatally. And there's a lot of false information out there because a lot of patients are carriers of these other traits and not aware that they can have a child with sickle cell disease because they've never been tested properly.
We spoke about it. We found out we were pregnant. The conversation came again with the doctors. It was a little scary because they gave us a little therapy session to talk to the doctors and for the doctors to explain to us about the disease and gave us the option for my wife to get a needle put in her to check the specimens of the baby, and I wasn't with that. My attitude to that was, we parents, we're gonna love our baby, whether the baby has the disease or don't have it. And we opted not to do it. And my son was born, he came out clean. And that was that. I mean, the question didn't come up again for us until she got pregnant with my daughter. It was kind of difficult to have the conversation with her again because she was very emotional the first time. And it was just hard. It was real, real hard.
While she was pregnant, I remember the doctors doing this chart where they would determine the likelihood of our children having sickle cell. And then they were asking us if they wanted, if they could go in and like stick a needle in her and find out if they have it. And it was like, well, it's pointless because if they do, it's not going to change the fact that we're having them. So it's not going to change anything. So we told them no, we didn't want to do it. And then when the twins were born, they came out good and clear. I felt blessed. I felt God looked down on us and to make sure and they didn't have the disease, and it was great. And at that time, I said, we will probably, this is it. We got our blessing. We got twins. We don't need no more children. I mean, she had a tough pregnancy, so she was with it too. Like, no more kids. That's how we felt at that time. And 15 years later, well, 14, I think they're 12 years later, 12 years later, here comes Keanu. And when we found out that he had sickle cell, it crushed us.
So there are different strains of sickle cell. The sickle cell, you have the sickle cell SS, it's the double sickle strain. You have sickle cell SC. And then you have a few different types of sickle cell beta thalassemias. There is more than one type of sickle cell disease, and each sickle cell disease phenotype has different levels and risks for complications.
Finding out that my daughter had SS affected me a lot, because that is the worst type of sickle cell. It was just difficult. It still is difficult. But you know, looking at her every day, you couldn't even tell. True warrior. 17 months. 7 blood transfusions. And she walks, she talks, she plays. How? That's all I ask. How? Why?
So when I start proactively, I'm starting at the very beginning, day one of meeting a family, and working with the entire family. How is this disease going to impact the other siblings? How is this disease going to impact the grandparents, the aunts, the uncles, the cousins, the parents? To get the entire structure and support system for the family to understand the disease, so therefore they can all work together towards the disease and caring for this child. So proactively first is to get everyone on board.
Having a sister with sickle cell makes me feel like it's different, because it's something new, and I don't know, it's different. Like, she might lose her life, she might make it out the hospital. Anything can happen, so it's just like, it's different.
How does it make you feel?
I like having a little baby sister.
Like it?
Well, I like it. So I like it getting that shot.
You like her getting shots? You don't like it, right?
That was a real emotional moment for me. Because I didn't expect that. I didn't expect to have to stay. I never took Bryson to the doctor with us. And just to see his initial reaction, to be a 3-year-old kid and grab his sister and let her know that he wasn't going nowhere, he wasn't going to leave her, it broke me down.
Keanu having sickle cell hasn't have affected his brothers. Like, it made them more responsible, because they get left alone a lot, you know? And now they got their little brother to look out for. And I mean, they be doing an awesome job. They don't let it, you know, affect their day-to-day. We try not to let it affect their day-to-day life. Still let them do the things that they want to do. You know, live a normal teenager life. But when he goes in, you can see it in their faces. They're not happy about it. And, you know, they come to the hospital, hang out with him, and just be big brothers to him. How do you feel when he's in the hospital and your mom and dad have to go back and forth to the hospital?
Upset. I don't know.
like, it is upsetting, yeah. But then again, you know, when he first started doing it, I knew that I had to kind of get used to it because it'd be happening a lot.
How were you notified that your child had the disease?
That's the next question.
Can we pause? What am I afraid of as far as Keanu in the long run? I'm afraid not really of much. I think whatever is coming down the line for him, it's in his destiny. It's the way God wanted to happen. I'm a man of faith, heavy faith, and I believe that all this is for a reason, and that I believe that he's going to be okay. I can't speak on being afraid of anything wrong in his future when I pray for the best of his future. I pray for the normal life for him in his future. I pray for marriage, and children, and a career, or whatever it is that he want to do. And I believe he's going to get to do those things. He's so full of energy.
My name is Tajanique Lido. I'm from Rochester, New York, and I have sickle cell anemia SS. I don't believe there's enough doctors that are, practicing sickle cell or educated in sickle cell. I do feel like it's overlooked when it comes to like the specialties that doctors have. They feel like, okay, if I am gonna have a specialty, I'm gonna do it on something that's more like, global, like cancer, like we talked about, or maybe AIDS or something like along those lines. I just feel like because enough people are not talking about it, that they feel like, okay, it's one of those things that can go to the back burner. It's one of those things that it's like whatever. And that's actually why I wanted to get into the medical field, because I do want to eventually, be a hematologist or a pediatric hematologist or something along those lines, because like relating to the kids like we talked about, like it's one thing to say, okay, this is what it says in the book, this is what it's supposed to be like, but this is what I actually went through. This is what I feel. This is my experience with it. So I can sit here and relate to you. I can actually be empathetic instead of just saying, basically just being there for a check. It could be more, it's more personal. And that's why I decided to start nursing.
My name is Amy Serrano. I'm 31 years old from the Boogie Down Bronx. I have sickle cell anemia SS.
We gotta find remedies, and then when you argue with the doctor, like, I don't want a blood transfusion, they think you're going against, you're going against medical, and it's just like, well, it's nothing else we could do for you. Shut the fuck up and give me some beet juice and give me some salad, and I know what I'm gonna do real quick. But I know if I was to need it, like I was in the hospital and they woke me up. They it was a team of doctors like, Serrano, are you alive? They was like, your blood level was at a 3.2. I don't know how you still bleeding. Like, we need to give you an emergency blood transfusion, and that's the only time I gave it to them when it was needed.
My name is Aaron Samazi. I'm from the South Bronx, and I have sickle cell SS. When I was being born, I was actually a twin. My first twin was a stillborn. So they automatically thought that I was going to be a stillborn too. And then I started breathing. So they thought, it's a miracle baby. And then I stopped breathing. Oh my God, he needs a blood transfusion. And my father's like, whoa, what? We don't do that. Jehovah's Witnesses. My mom like, what? No, we don't do that. So they're like, if you don't do this, your child is going to die. So they had to give me that emergency blood transfusion. So I come right back up to ICU with a severe infection. And they're like, oh, he has a fever, I don't know why. So there was this big thing about the blood transfusions and how that really can, affect your system on a bad note. And one thing I had to do is research myself. Like she said, beet juice works. Carrot juice, all that, even within smoothies and regular shakes, those things help. And I always, for other sickle cell patients I encounter, I always tell them, if you don't need it, don't grab it. Don't listen to the first opinion they're giving you, because it will affect you in the long run.
David Burks, I'm 34 years old, have hemoglobin C, I'm from Harlem, New York. The signs that my body gives me the I guess the inclination that I'm going into having a crisis is I guess fever, one of the things, chills I get, and then I get like this achiness in my body where it's almost like you just know. And it's an achiness. It could be brought on by the weather, frequent weather, when the weather changes too frequent and you try to adapt to it. But that's one of the things that happens where you just know it's time to go. And then you have a series of preventatives that I do, from hot showers to relax the actual muscle that you're having the pain in that joint or whatever it may be. I have a series of preventatives, from taking Tylenol number 3, because I've been dealing with this for a long time, so I don't opt to always just take immediate pain medication. I fight that. That's one of my things. And like my brother said, I'm not one of them criers. I got a high tolerance for pain. I think we all do. But that's one of the things that happens. You just get just to go in detail where I had pneumonia, double pneumonia, that led to sepsis, which is a blood infection. I had picked my little brother up, and it was like maybe about 12 at night from work, and you just knew. I knew something wasn't right. You know your body.
Hi, my name is Arcelis Batista. I have sickle cell SS. I'm from the Bronx.
Hi, I'm Nana Ibrahim. I'm 32 years old. I have sickle cell SC from the Bronx. With blood transfusions, I can honestly say it saved my life, only because I was diagnosed when I was 13. I had a stroke in my sleep, and if it wasn't for my brother's doctor, I think I would have been dead, because he was the one who saved my life. My parents rushed to the emergency room, and he seen our last name. He automatically thought it was my brother and my sister who was born with it. I was diagnosed when I was 13, so it was just different, all the way around. I have SC, so they was like, you're not supposed to have a stroke, nevertheless, go through all of this, and transfusion saved my life.
So let's just start with some misconceptions about sickle cell. On the top of the list, I would say people think sickle cell is a pain event. They don't understand that sickle cell has far more complications than pain. Risk for stroke, risk for retinal damage, risk for kidney damage, risk for permanent bone damage. It's far more than just sickle cell pain. That is a major misconception. Another major misconception is that sickle cell trait and sickle cell disease are different. It's not the same thing. I'd say those are the two top misconceptions.
So this is a disease of the blood. It's sort of an invisible disability, we could call it. So you might not see that I'm in pain because I need to get through my day. It's not like I am a stroke person with half my body not working right. So you're not going to see something about me or my child that is going to scream out loud, help me. But the last thing you want to hear when you're having this pain, this nagging pain, I can't describe what it feels like, but it's a nagging pain. And someone being as ignorant as asking you about, oh, you look okay, are you fine? So it really frustrates me. I think we have a lot of work to be done here in Accra and Ghana for them to stop reading things by the book and just applying the book knowledge to a person, because we are all different individuals. So everyone manifests sickle cell differently.
I've been fighting it over the weekend because I didn't want to spend New Year's in the hospital. So I was just avoiding the pain, taking my medicine. But Sunday, I was getting ready to go out and I caught diarrhea. And I know the diarrhea was going to bring a flare up because my body's dehydrated now. I couldn't make it. I halfway finished my hair, came to the hospital. Come to the hospital, they try to treat me as home remedy, whatever I take at home, they're giving me to the hospital. Because I had diarrhea, they wanted to start an IV line because they already know I need fluids in my body. And they drew blood and my level dropped to 7.1. So I already knew I was getting admitted because just Thursday I was at a 7.8. It's Sunday, 4 days later I'm at 7.1. I get admitted, they start treating me for pain, but they're giving me medicine that I'll take at home, oxycontin 30 milligrams, and then diluted for a breakthrough, 2 milligrams. And the pain is just non-stop. And I'm complaining to the doctors in the ER. And I'm telling them, like, the medication is not helping. So I finally get to bed, I come upstairs, they draw my lab again, and my level's at a 6.3 now. That kind of explains to them that I really am in a crisis, and this is hurting.
And I'm going to tell you sickle cell pain is hard. I'm going to tell you, and I share with you, that in my 15, 16 years of taking care of sickle cell disease, I now walk away and I realize, and I share this for parents, that how sickle cell pain is managed early on in life has profound consequences for the remaining life. I now know that children becoming young adults, when they have a pain crisis, they can be haunted by their pain crisis from years ago. So they could have a pain crisis, it may be a level 5, a level 7, but if they were tormented early on in life with pain, their existing pain, they live in fear that it's going to get worse. And so therefore, early on now, I work with parents to say, if your child's having pain, we're not going to wait. I'm going to teach you how to take care of pain immediately and give you the tools to take care of pain immediately. No child, no person, no adult should be living with sickle cell pain. And so we have to address that early on.
Keanu just suffered his first pain crisis. It was in his kneecaps, actually. It only affected him while he was asleep, though. We were told that because of the lack of circulation when he's sleeping, the blood was actually pooling in his knees. So he was waking up screaming in excruciating pain for the last 6 nights. Thankfully, it has passed. His doctor was able to call in some Tylenol with codeine. We gave it to him before he went to bed and bought him a heating pad. And he's been fine. I wouldn't say we're lucky, but we kind of are lucky that he's 3 and he just had his first pain crisis. Because when he was diagnosed, we were warned that between 3 and 6 months would have been his first pain crisis. So the fact that he's gone through years and not have pain crisis, and then his first one wasn't a major one where he needed to stay in the hospital. We were able to treat it at home, and it passed.
It goes from 0 to 1,000 really fast. Like right now, I'm okay, but my hips is what's really hurting at this point. So it's annoying to move around. It's really hard. It's annoying to walk, anything like that.
The most proactive way to deal with a child with sickle cell disease is to see a pediatric hematologist or oncologist who's well versed in sickle cell disease at a center that takes care of a large number of these patients and has the expertise to help you guide your child. Most of these patients are diagnosed in a newborn period, so it's very critical to have early intervention. And with early intervention come less chronic problems. So my goal now taking care of patients is that they are able to attend school, get a job, go to college, whatever they're supposed to do. And sickle cell disease happens just to be part of their life. The only way that we have been able to do that is by parents and patients being proactive and seeking care before they're sick.
I think we need better treatment in Ghana at the moment because we don't have enough hematologists, we don't have doctors that actually understand the sickle, not just doctors but also nurses, healthcare workers in general. We have stigmatization, we have people, anytime you're in crisis, it's assumed that you are seeking pain medication, it's assumed that it's just another crisis, but not better investigations are done to determine exactly what is causing the crisis and why.
Give me 1 unit of blood, meaning 1 bag of blood.
And that's blood that
people, no, it's blood that people donate that don't have sickle, that they're all circled like blood shapes, and they're not sick. And they're my blood type. I'm O positive, so that's why they have to go to the blood banks and give me blood to help me push forward for the next day. Because with no blood, my levels is constantly dropping. I'm at a 6.3. Who knows where I'll be at in 4 hours if I don't get a blood transfusion, or tomorrow, because my cells are not reproducing properly. And the everyday struggle is terrible.
Y'all ready for this?
I'm okay with the treatments regarding sickle cell disease because the doctor is very informative. And I myself have a lot of knowledge of what's actually happening because myself and my wife have done a lot of research on sickle cell. I mean, at one point we even had to get a second opinion just to make sure that the decisions that we were making as one were beneficial to my baby.
There's a lot of exciting research going on for sickle cell disease right now, and I'm very happy to say we're part of it at Rutgers Cancer Institute, New Jersey. We're doing a number of clinical trials on sickle cell disease right now using new drugs that are not actually readily available as of yet, and some of these modalities we're using are very exciting, and I think are going to change the way we treat this disease.
Multivitamins. Multivitamins is just basically to keep like the small little vitamins that you have in your body, like from the vitamin D's, the C's, the A's, the B's. Instead of getting the B12 shot, you take multivitamins because the vitamins, everything consists of that vitamin.
Now have many of our patients on a drug called hydroxyurea.
I believe in hydroxyurea.
And that's hydroxyurea. It used to be called urea, Hydrea was the brand name. Now it's a generic and it's hydroxyurea. And we know a lot. This is one of the mainstays.
Which has been a game changer for patients over the last decade because being on hydroxyurea raises what's called your fetal hemoglobin as well as some other positive effects. And as a result of that, these patients don't get as many crises, they are not in the hospital as much, and they do much better. And I suspect that over time, they're gonna have a lot less chronic problems than the previous generation of patients did.
I can also tell you, and I'll share with you, I had a school teacher, a mother of a school teacher in New York City, at risk for losing her job because she was out of work so often caring for her daughter. When her daughter started hydroxyurea, 2 years later, and 2 years later, she's never missed another day of work because the pain crisis stopped for her daughter.
A problem with transfusion. And this is one of the, it's life. If you give transfusions, the iron breaks down. So there are these drugs that you might be indicated to rid the body of or chelate the extra iron that's in the body due to all the transfusions. The furoxamine. So that could lead to another disease. What the guidelines, and the latest guidelines were 2014, come out, and they talk about hydroxyurea, knowing that bone marrow transplant is the cure, but we still say hydroxyurea because hydroxyurea, remember, bone marrow transplant, it's there, it's costly, but you don't find a good match all the time. So they say with hydroxyurea, it is to offer hydroxyurea. The guidelines don't say you should use hydroxyurea. Why offer it? And that's the point, is that it involves cost, it involves blood tests, it involves visits to the doctor, and it's costly. So that hydroxyurea should be offered to the parents, to the child that has it, and then to consider, am I going to be able not only to afford it, but to keep up with the need and the monitoring that's associated with hydroxyurea.
For sickle cell cures. Well, a good news for you right now is over the past 15, 20 years, there has been substantial research for sickle cell cure with bone marrow transplant. And bone marrow transplant is a viable, available cure for sickle cell disease. Though I will add, there are two significant considerations with sickle cell transplant. One has to do with the donor for sickle cell disease. Is the donor a perfectly matched donor, or is the donor not perfectly matched? So there are different considerations when you talk about transplant for sickle cell disease, but for those children who have a perfectly matched donor, the cure rate is extremely very good.
Instead of just regular old-fashioned medicine, there should be more natural treatments that you can give. A lot of the doctors, they just push whatever medications that's out there, which is really none. So I think there should be more natural treatments because a lot of people don't want to fill their kids' bodies or fill their bodies with just or any kind of chemicals. It should be something more organic and more natural that you can actually put in your body that's safe and that'll help you.
How do you feel about the treatments?
The treatments currently offered, there aren't many. Besides ceftriaxone, which is a broad range antibiotic, or pain meds. Outside of that, they give them preventative penicillin, vitamins, or a drug called hydroxyurea. Right now, that seems to be the only drug that they offer. My son was one of the first babies to start taking it. Usually it's later teenage years to early adulthood where they start prescribing hydroxyurea, which is actually a chemo drug that is supposed to elevate the hemoglobin, which is an issue that they have. Their hemoglobin drops. It causes all types of issues and pain. Organ failure, so on and so forth, because their bodies actually don't have enough blood. But you would think a disease this old, because according to history or to the medical books or documents, sickle cell anemia is one of the oldest inherited blood disorders in the world, not just in the United States. So the fact that the only treatment we have right now is a cancer drug or pain medicine is like, why?
One is it's a very common illness, and sometimes illnesses that are more common tend to get less attention because people look at them like as something that happens frequently, and they just get used to it. And we see this not so much in the United States, but in a lot of other parts of the world where the disease is so prevalent, it doesn't get the attention that it should, paradoxically. And in the United States, I think part of it is simply socioeconomics of the disease. It affects primarily African Americans in the United States and a disproportionate number of patients who may not have the means to lobby and advocate for themselves.
As a young child, I always thought about that, like, wow, my cousin won't live past 21, and I used to count down the years, literally, and that's why I became so close with her. Like, right now, she's 41, kids and everything.
With this sickle cell disease, I had a very great support system with my family from the time that I was born, because they all watched over me. They all made sure that I had medicine when was needed and that someone was always home with me to deal with whatever I was going through at the time of a crisis. And most part is my grandmother, she always took me to church every Sunday from the time I came home out the hospital till as a grown woman. Made sure I had faith in God and understood what my disease was about.
In Ghana, it's been a struggle, but it's been improving. In Ghana, it's been a struggle, it's been improving. In Ghana, it's been a struggle. Since childhood, we've been blessed though. They have had really good pediatricians. I've been able to meet pediatricians that are knowledgeable to some extent or have been trained abroad and have a good experience of sickle cell issues with pediatrics. But along the way, I have also educated myself as much as possible so that when there are any issues where I feel things are being swept under the rug or issues are not being dealt with, I'm very knowledgeable. I always have like second or third opinions. We've been blessed to have practitioners in the UK, practitioners from the US, and over time I've met other parents who have introduced me to amazing professors.
One of the biggest problems as a pediatric hematologist and oncologist is what do we do with our patients as they age out of our practice. It's actually a good problem because that means we have patients who are growing up and aging out of our practice, because it wasn't that long ago the majority of patients didn't survive beyond their 20th birthday. Now almost everybody with sickle cell disease is expected to go to middle age and beyond. So we are now working with our adult colleagues to have adult programs that mirror the pediatric programs. They're not quite there yet across the country, but it'll take some time. But that is still a challenge.
I remember as a child, my best friend, me and her did everything together. But I noticed she would get sick all the time. And one day I missed her for a couple of days. And her mother told me that the doctor said she had sickle cell and that we might lose her. And of course, being a child at 10 years old, I wanted to know what lose her meant. And that means that it was possibly she would die. As far as I knew, at that particular time, sickle cell was a blood cancer. It was cancer in the blood. So, as being my only friend, really friend, we played every single day. I was heartbroken. And I began to pray for her. Shortly after that time, Cynthia came out of the hospital. That was her name, Cynthia. Cynthia came out of the hospital, and her mother explained to us that she was very, very sick. And one day, we didn't know what was going to happen, if she would get over it or she would pass away. And they wasn't sure at that particular time. So we're talking about 60 years ago. Well, as we began to grow older, go to school together, graduate together, Cynthia was still there. One day, when I was in Austin, Texas, Cynthia called me and she told me how much pain she was in. And she was in excruciating pain. She couldn't talk. Well, that's the day we lost her. But just imagine, she lived 50 years with the disease of sickle cell.
Did you want a mathematician? What were your dreams? We talk about the dreams for their child, their unborn baby, who is now in front of them. And I tell the families, that your child still can be the ballerina. Your child still can be the sports player. Your child still can be the mathematician. But they're going to be the mathematician with sickle cell disease. We talk about early on what is sickle cell disease. We talk about the role of penicillin, starting an antibiotic when you're 2 months of age. And we begin to talk about what I term the 2 Ps, prevention and protection. I'm going to help you as parents understand what you have to do or we need to do together to prevent sickle cell complications. And then together, if a complication sneaks through, what we're going to do to protect your child. And over time, we create this relationship and we visit each other often. Maybe we see each other once a month. For some families that I'm afraid they may not give penicillin or they may be afraid of penicillin, I may say, come back in a week. Let's talk more about it. And over time, I develop relationships with families of living with a chronic illness. And it's just not the child that's born with this disease, it's the family who needs to live with it. It's the grandmother, it's the aunt, it's the stepmother, it's a brother, it's a sister, all living together with what is sickle cell disease. Sickle cell disease, very much an uncertain disease. One day you're fine, the next day you have pain. One day you're fine, then you get a fever. Now you're in the hospital going to the clinic 2 days for antibiotics. One day you're fine, then you have a cough. Family's concerned, will you develop acute chest? One day you're fine, you have a pain on your side. What is it? One day you're fine, you have a bellyache. Is the bellyache constipation? Or is the bellyache sickle cell pain? And so we're talking about over time how to live well with this disease.
I think that there needs to be a place in time where someone can be able to bring groceries to families that need to be staying in the hospital for 3 and 4 days. Because the meals don't come to feed families. The meal is provided for only a patient. What about the single mothers that don't have child care, who have 3 and 4 kids and got to be in the hospital for 3 and 4 days? There's no food being provided for those families. It's rough.
It is cabin fever. Oh my God. Being in the hospital all those days in a row, it gets to you. I mean, you can tell it gets to him too, but he makes the best of it, you know. He has all the toys in the world. They spoil him to death. But, oh man, as a parent being there, and it's costly. It's a little expensive because everything they do for him is, you know, is covered under the insurance. But when it comes to the parent there, they have nothing for us. Like when it's time for him to eat, it's like, oh, all right, we got to get somebody to watch him while we go down and get ourselves something to eat or order our food. Now you're eating out. You're not home cooking for the kids, so now you have to order food for home or have something ready for them, which is also hard to do. Parking isn't free. I mean, they discount it in some hospitals, but just having your car out there all those days, it becomes costly.
The lack of treatment and research regarding sickle cell is very poor. No, extremely poor. There are a lot of families facing this disease and don't have nowhere to go. You have some people that are told your child has a disease and they're just like, all right, this is what it is. And you don't want to say that they're comfortable or complacent with it, but they get used to the fact that there isn't any outreach programs that they can go to, or there isn't any place that you can go to as a family for therapy to talk about it. Like, it just keeps them in a place where they're comfortable and not really want to learn about the disease or want to put themselves in a position to be around people with the disease to learn more or figure out a better way for themselves or for the kids to eat better. It's just like, this is what it is. We gonna deal with it. And I want to change that. I'm gonna change that. No, we gonna change that.
So there are a number of meetings that those of us in the sickle cell arena attend on an annual basis. Probably the largest one is the American Society of Hematology meeting. That's not just sickle cell, but it is a meeting where a lot of new research is presented and a lot of discussions are had by physicians who take care of these patients. There are other groups as well, for example, the American Society of Pediatric Hematology and Oncology, and there's also National Sickle Cell Disease Association of America. In regards to local outreach, we do work with some local groups and to do outreach for patients locally. And we encourage, local residents to attend. We have education meetings periodically where we talk about a certain topic that's regarding sickle cell disease that we know that the community is very interested in.
Sickle cell, wear burgundy, bring noise. And this is my favorite backdrop of my campaign and its logo. Anytime I do any events, host events, or the walk, or spread any awareness on sickle cell, boom, I have my own backdrop. So you can take pictures, hashtag it, who knew, just makes a lot of noise. It's very catchy, it's different. And people need to know about us. People need to know about sickle cell. It's very real out here. I know I look good, but I be suffering, man. I tell people that all the time. If my insides was screaming, you ain't want to know. Yeah, so it's very dear to my heart. My campaign, my logo, who knew? We do it all. We do walks. If you ever need it for a backdrop, let me know.
As far as me doing my part to raise awareness and research, I'm the president of Righteous Riders for Christ Motorcycle Ministry. And for the past 4 years, this will be our 4th year now in April 2018, we do a bike blessing / sickle cell fundraiser. And we raise money at these bike blessings and we donate all the proceeds to Robert Wood Johnson Research Center. And out of their gratitude for us raising money for their research on sickle cell, because it goes directly to their sickle cell research department, they named their sickle cell research department after Keanu, which is awesome. So at Robert Wood Johnson, Keanu's name is in there for sickle cell research. It's called the Keanu Emmanuel Davis Research for Sickle Cell, or Sickle Cell Research. I may have it twisted. We want to thank everybody who helped out. First off, give a glory and honor to God that brought us two brothers together. We started off with our children in the situation, and a man right here said, "Look, we got to do more. We gotta make noise. We gotta be big, just like cancer situations. Everyone knows about cancer. On October, everybody wearing pink. So September, everybody gonna be wearing burgundy.
We painting the town burgundy. Noise.
No more pain. Sickle cell movement. We want to thank Who Knew Foundation. We want to thank Roy Alexander for recording this thing.
We want to thank our families.
Right.
We want to thank our friends. We want to thank all the people that helped us put this thing together.
If this thing is out before September, 3rd Sunday of September, I'm not sure what the date right now is, but we're going to be in the African American Day Parade.
Right.
All wearing burgundy.
All burgundy.
No more pain.
Noise.
Sickle cell movement. We're going to be making noise. We're going to bring in more recognition into the disease. We're going to find that cure. We're going to get it all done, starting right here.
David Burks, and I am the face of sickle cell.
talking to you. Be hopeful. Only the strong survive. Be solution seekers. Be marathon runners. Only the strong survive.
My name is Silas Corey Davis.
And I'm Vita Davis.
And we are the face of sickle cell.
The face. We are the face of sickle cell. It's real out here. Just because we don't look sick, that don't mean we're not sick. Our body is battling the disease every day, but every day we get up and fight. You know why? Because people need to hear our story, and I hope our story encourage you to come out to the next event that we have. Peace and love.
My name is Shanada Davis, and I am the face of sickle cell.
It's Henry Martinez.
My name is Dijon Martinez.
And we are the face of sickle cell.
I'm Joseph, and I am the face of sickle cell.
My name is Doris Polanco, and I have sickle cell SC. And guess what?